Like, we have to get it to get past it. I think the United States said, all right, that's our plan. If there's only one way to get there, well, that's the way we're going to go. China seems to have picked a plan which, for political reasons, looks terrific. The only way that China's strategy of eradicating it would work is if the rest of the world did the same thing and succeeded, but they can't. So China has a strategy that can't work. Now, here's some good news, if you can call it that. Good news is relative. But the world is, a lot of countries are handling things differently, which means that we have massive A/B testing. So we can look at South Korea and all the other countries and say, all right, what worked and what didn't work? Now, that's a rare situation. You don't normally have this many laboratories working simultaneously. And some of these laboratories are going to come up with good results and some are not. So it's very likely that the result of all this different approaches is that we'll find one that works best. People will know it, because everybody's communicating, and they'll quickly adopt the best practices. I might say this every day during the crisis. My personal crisis management system, and by the way, I recommend that you have a system, not a goal. If your goal is to not get it, you're thinking about it wrong. You should have systems in place. I would recommend that you build a system for your own immunity. Ivanka Trump retweeted me yesterday, my tweet about we'll see more human ingenuity in the next 2 weeks than you could imagine. It will be breathtaking. You're seeing it already, but the level of genius that is being applied to this is a global level that we've never seen before. Correct me if I'm wrong, but because our strategy is guaranteed to work with some amount of extreme pain, but it's guaranteed to work, we don't have any doubt that when we get to the end of it and enough people have been exposed, that we'll be okay. That seems to be a solid assumption by all the experts. Now, there's a rumor going around that you can be infected and reinfected, and I would say that the experts are not saying that. It was a rumor on the internet, but when you listen to the experts talk, they talk about herd immunity, which means that it's not a case of once you get it, you can get it 100 times again. So there must be immunity. So I wouldn't believe the internet rumors that there's something unique about this particular one, that it's the only one you can't get an immunity to. That doesn't seem to be demonstrated. But the point is, the only way that China's strategy of eradicating it would work is if the rest of the world did the same thing and succeeded, but they can't. So China has a strategy that can't work. What are they going to have to do when they realize that their strategy can't work? There isn't any chance it would work. There's none. It's not like it's a long shot. It's a zero shot. And I think every expert would agree with me on this. I think everyone, 100%, would agree that it can't work. So here's what's going to happen, I think. I think the United States is going to get ravaged, but we'll pull through, because we're pretty good at pulling through. And when I say ravaged, I mean most of you won't even have anything except a few weeks off of work or whatever, some inconvenience. But, old people might be dying at a higher rate, and, it's going to press our medical staff and inconvenience us and, whack our economy for a while. But I think the United States has decided to pull off the Band-Aid. You know what I mean? Like, we have to get it to get past it. I think the United States said, all right, that's our plan. If there's only one way to get there, well, that's the way we're going to go. China seems to have picked a plan which, for political reasons, looks terrific. So if you're the outside world and you're looking at China, you're saying, wow, that's terrific, China. Look at what you've done, the sacrifice you've done, and that's protecting the world. And it probably is. And by the way, thank you, China, for, again, I'm not loving the government over there, but it can be said that the individual Chinese citizens fighting hard to stop this thing have done a solid service for the rest of the world. It wasn't their fault. The average Chinese healthcare emergency person, it's not their fault the virus got out. They're just sacrificing their life to stop it. So thank you, sincerely. The government's another question, of course. But it seems to me that China is going to have to adopt our strategy. And when they do, let's do some numbers. Let's say best case scenario, they can get it down to a 2% death rate. Now, in other countries, we have hope it could be under 1%. South Korea, maybe that will be our experience. Italy is higher. But let's just pick a number. Let's just say that China could get it down to 2%. But eventually they're going to have to let people get it, because that's the only way they're going to get past it. So they'll have to give up on their trying to eradicate it and locking down everything. They have to open for business eventually, or else everybody will starve to death. When they open for business, it's going to go right back to where it was, because it has to. There isn't really any possibility China won't go right back to where it was, right? I mean, seriously, there's no possibility that it won't ravage the country as soon as they, stop locking people down. So if it does, they got 1.3 billion people over there. What's 2% of 1.3 billion? Yeah, we're talking about World War II level casualties just in China. And I think that's inevitable. Because again, somebody says vaccine, but the vaccine's probably 18 months off, and I don't know how effective it will be, and I'm not really sure we can make one. Maybe we can. So is China trying to eradicate it until the vaccine comes out? Because they can't wait 18 months. There's no way they wait 18 months. I think they're going to have to loosen things up in a month or two, and then it's just going to ravage the country again. So I think the U.S. is going to come out better because our strategy is just better than their strategy. Now, maybe they had to do it the way they're doing it just to sort of slow it down and get a handle on it. But ultimately, they're going to have to adopt our strategy. And when they do, because of the size of their population, it could be a 40 million people dead just in China. Now, we might get it down to, say, 1%. And then we might have, 500,000, 1.5 million at risk here as well. But it would be the older people who we already know are at risk. Now, here's some good news, if you can call it that. Good news is relative. But the world a lot of countries are handling things differently, which means that we have massive A/B testing. So we can look at South Korea and all the other countries and say, all right, what worked and what didn't work? Now, that's a rare situation. You don't normally have this many laboratories working simultaneously. And some of these laboratories are going to come up with good results and some are not. So it's very likely that the result of all this different approaches is that we'll find one that works best. People will know it, because everybody's communicating. And they'll quickly adopt the best practices. At the moment, we have pretty good practices. But clearly, given that everybody's doing things a little bit differently, there is something that's a best practice. We just don't know what it is yet. We're getting close. Let me give you some examples. So in China, some of the things they're doing differently is they have portable CT scanners. What? Where's my portable CT scanner? I just had a CT scan. I had to go to the office and get on this big bed, and it's got these things that pass over you, and it's a big operation. But China apparently has lots of portable CT scan equipment, which apparently is really helpful because they can scan you, and I guess there's something visible in the lungs that can confirm the virus. So if you have a portable CT scan, as they do in China, that's one of several ways that they have of testing. Now, why is it we don't have portable CT scans in the United States? That's a question for you. Why don't we have them? Or do we? Do we? I don't know, but I did a little bit of research into medical expenses some time ago when I was trying to understand for myself why everything is so expensive. You know, where are all the costs in this big, you know, budget of healthcare? Where's all the cost? And one of the things I found is that there was a story of somebody who had, and I'm just operating from memory here, so I probably get some of the facts wrong. I believe there was somebody who invented an MRI machine that was like a tenth of the cost. And red tape prevented him from building it and selling it. That's right. Red tape in the United States prevented a guy from building and selling a device he'd already invented. We know it works. He built it. He built it and it works. It was like a tenth of the cost. And he just couldn't do it because of the red tape. Now, China's got all these portable CT machines that don't work as well as the big ones. But in a pinch, they can at least tell if you've got some visible signs in your lungs fairly rapidly. And my guess, I have no reason to believe this is true from facts, it's just experiential. I would guess this is true. I'll bet we couldn't get that built in this country. Somebody says define portable. That's a good question. I was assuming it was hand carried, but portable might mean something else. You're absolutely right. It could mean you put it on the truck and take it somewhere. You know, it could be a bigger unit. I don't know. But the point is, they have lots of them and they're portable. I don't think we have that. I would bet that that's something that the president could fix with an executive order, meaning that there's something stopping those from getting built, probably, and it's probably the government. All right, so that's one thing. The other thing that China's doing is temperature testing every time you exit or enter a building, apparently. So they must have lots of access to portable temperature-taking devices. I don't know if we have enough of those. And they're doing that. We're not doing that. But it makes more sense that they're doing it because they're trying to eradicate it, it looks like, and we're not. We're actually not trying to stop it. That's such an important distinction. If you don't understand that in the United States we're not trying to stop it, just slow it down, then nothing else will make sense to you. Because you'll say, well, why are some kids still, why are people going out in public if we're trying to stop it? And the answer is we're not. Here's another one. In Germany, apparently, and this is information from, Ken on the internet and some sources. So everything I say on this should be subject to fact checking. But apparently Germany is recommending or pushing pneumonia vaccines. Because if one of the reasons that people die is that the virus causes pneumonia and then it's the pneumonia that's the cause of death, Germany seems to think that the pneumonia vaccine is helping. Now, I don't know if I've had a pneumonia vaccine. That might be another one of the variables. For example, how many of the Italian senior citizens have taken the pneumonia vaccine? I have no idea. How many people in South Korea have had the pneumonia vaccine? No idea. How many in the United States? I don't even know if I've had it. Because I'm over 50, so I'm a candidate for the vaccination. I think my health care provider would have given it to me? No? Or do I have to ask for it? I don't even know how that works. So it's a big question. Then the other thing that China does is if anybody has symptoms, they separate them from family immediately. Could we do that? Do you think we could put children in cages in this country? Okay, I'm saying it in the provocative way, but you see what I'm getting at, right? If the United States started separating parents from their kids, it's going to look like kids in cages pretty quickly. But China's doing that. If you've got the flu, You're not going to see your family for 3 months. They take you immediately to a quarantine type of place. But again, we're not trying to stop it here. We're just trying to slow it down. Now, I tweeted around a great article talking about the difference in the old people in Italy versus South Korea. And apparently Italy's big problem is they just have lots of senior citizens. So, it's no surprise that they had more deaths and problems in hospitals, etc. So, that might explain the entire difference between Italy and everything else. But there might be one other difference. In this country, one of our biggest problems might turn out to be one of our biggest lifesavers, which is in this country, if you're a senior citizen, you're likely to be turned out to pasture to go live in isolation by yourself and die in loneliness. Maybe you have a partner, maybe you don't. But in this country, we kind of isolate senior citizens. They often have kind of lonely lives. Is that the same in Italy? No, so I don't know. In Italy, are you likely to be living with your family if you're 80? And somebody says no visitors to nursing homes. Yeah, and I wonder if in this country, we are socially so, let's say, hostile to our elder citizens, which could not be more obvious than the fact that the, boomer remover is a hashtag that's trending. Literally the idea of, culling the herd of all the old boomers. The young people are sort of celebrating a little bit, sometimes privately, sometimes not. We have a weird culture where old people are disrespected and therefore put out to die in isolation. Could that help us? It's a horrible situation, horrible. But it might have something to do with why Italy has so much problems and maybe we would not. We'll see. The schools in my area closed. Have your schools closed? So here's my question. So yesterday I was saying what I really, really, really need, just as a parent / step-parent, I really need the government to issue some guidelines about what to do with the kids who are not going to school because the schools are closed. Can they play with friends? Can they play with one friend? If one friend comes over the house, is that okay? Because remember, we're not trying to stop it, just trying to slow it down. So my current thinking is that kids can play with friends while they're not at school, but we should limit the number, as if you could really do that. Because once they leave the house, if a kid leaves the house and goes to a friend's house, you have no control. All of their friends could meet at that other house. So it's probably going to be a lot of kids getting together, but not nearly as much as if they were in school. So it definitely makes a difference. But what is the guideline? How many should you let your kids leave the house? I need some guidelines from my government. I saw a suggestion going around the internet, which I embrace. Restaurants are just going to get just absolutely killed because restaurants seem like the kind of place you don't want to go when there's a flu epidemic. Peggy Noonan tweeted, and I think other people had this idea as well, that you should buy gifts if you're in a position where your income is not going to go down because of all this stuff, and a lot of people will be in that position. So a lot of people, if you work for a Fortune 500 company, you work from home, but otherwise your income would be about the same. So if your income is about the same and you were going to eat at restaurants, but you're not, it would be really helpful to the restaurant if you bought a gift certificate, because it could help them through the tough times. But in order to buy that gift certificate, you have to walk into the restaurant in most cases. So, that's sort of a trade-off there. But it's not a terrible idea. If we can find ways to help the local businesses, you should do it. Ivanka Trump retweeted me yesterday, my tweet about we'll see more human ingenuity in the next 2 weeks. then you can imagine it will be breathtaking. You know, you're seeing it already, but the level of genius that is being applied to this is a global level that we've never seen before. I mean, this is similar to the Manhattan Project on a global scale. You know, the Manhattan Project to develop the bomb worked because the smartest people we could find were put in one place to do it. But now the smartest people on the entire globe, for at least smart in this specific way, are engaged in this one task. We've never had this before, and it looks to me like the inventions, the thinking that comes out of this is going to be just amazing. I mean, we could easily come out of this with a solution to coronaviruses, which seems even impossible. So yesterday I was asking about ventilators and the access to them. We've learned a lot since then. But one thing I have not learned, and maybe somebody can tell me in the comments, what's the difference between a ventilator and a respirator? Because I see both words being used as something that is necessary equipment for people who are in the worst situation with it. Are they the same thing? Is a ventilator and a respirator the same? So I don't know that. But I asked about ventilators because I'd heard that word. And I asked this question, why had there been no reporting on how many ventilators we have available in this country? Well, as luck would have it, Joel Pollack over at Breitbart did some investigative reporting on that very question. And you can see his article in his Twitter feed or mine or at Breitbart. And here's what we learned about ventilator companies. So they're companies that make them in different parts of the world, but the United States has manufacturers who make ventilators. And when Joel called one of the big ones in the United States and said, do you have enough ventilators? Here's what they said. And this is mind-boggling, and I don't even know how to interpret this. But the company that makes ventilators in the United States during the middle of a crisis in which ventilators are a shortage said that they're getting lots of calls and no extra orders. What? I don't understand that. How could the company that makes them in the United States, and they said we're ready to ramp up, we expect to, we're all ready to go, there are no orders. I mean, beyond the normal amount of orders. What? What's happening? I don't understand that. Now, another thing I found out, which might actually explain the other thing, is that the United States is way better in having this kind of equipment. So apparently part of and here's my problem that I don't know if ventilator and respirator are really the same thing. So I guess I need to know that. Respirators incubate, ventilators need intubation. Okay. So it looks like the ventilator, maybe they need to stick something down your throat, and the respirator is just the mask? Is that it? So apparently the executive order, or the emergency thing, allows a lot of ventilators that might have been, in holding for military and other purposes to be available. So, and then I guess Trump said that we ordered some more, but perhaps not from this one company. So it could be that there's some other source, and Joel talked to somebody who didn't get the big order, but why not? So it could be that our experts have looked at the lay of the land and said, the ventilators in this country won't be our big problem. Maybe. We're going to find out pretty soon. So thank you for the answer that the respirator seems to be the mask, and the ventilator, I think they're putting a tube down into your lungs, a more aggressive approach. I think that's right. But again, you'll need to check that with me. So that's a big question, but I also saw that there was some data that 31 out of 32 people somewhere, might have been Italy, died after ventilation. So the thinking was, that they're using the ventilators to keep people alive a little bit longer, but they actually just die anyway. So it could be that we don't need that many ventilators because they don't work. That's possible. And I don't know if the president ordered respirators or ventilators. I thought he ordered respirators, but I might be wrong about that. So there's some uncertainty here. But the point is that we appear to have capacity. So in this country, there's at least smart people seem to think that we can get enough ventilators and respirators because we're starting early enough to do that. Might be right. Could be right. But congratulations to Joel Pollack, who I believe is the only person who reported on this. I've not seen any other report that actually talked to the manufacturers and said, can you do this? And apparently we can. I might say this every day during the crisis. My personal crisis management system, and by the way, I recommend that you have a system, not a goal. If your goal is to not get it, you're thinking about it wrong. You should have systems in place. And the systems could be, what do you do, if there's shortages of food? So, build a little system, put in some stockpiles, etc. There should be some systems in your house. For example, I have implemented the wash your hands when you enter system. Now, that's a pretty obvious one, right? When you enter a house, it doesn't matter if it's my house, or some other house. Whenever you enter a space, you wash your hands as the first thing you do when you enter the new space. That's a system. The other system I have is for building up my immunity, because my assumption is I have a higher likelihood of coming in contact with it, and I'm going to be ready. So I'm building up my immunity and doing a heck of a job, I must say. Pardon me while I pat myself on the back. Good job, Scott. I would recommend that you build a system for your own immunity. So here's what I do. I'm never going to skip a day of light exercise, even if I have to do it at 9 o'clock at night. I'll never skip a day of light exercise. Emphasis, light exercise. During this next year, I'm not going to try to build muscle. I'm not going to try to run a marathon. Because when you do those things, there's at least some part of your day where your immunity is low because you're sort of exhausting yourself to get to the next level. Don't exhaust yourself. A key thing you need to do is get plenty of sleep and don't exhaust yourself. So that's part of my system. Every day, light exercise, little light weights, sometimes every other day, and eating right, and I'm even staying away from foods that have inflammation properties. Somebody says, you're obsessed with this. It's nuts. Well, that's a block. When people say that somebody is obsessed or they're panicking, we don't need that. Because you don't know my state of mind, and I don't need you characterizing it as obsessed or panicked or depressing or anything else. All you know is what I say. So I would recommend to you, because my state of mind, I have to tell you, is quite excellent, because I've done such a good job taking care of my body that my mood and my sense of well-being is maybe higher than it's ever been, which is weird. So I feel just in a normal way, just sitting in a chair in any given moment, I feel great. And it's because I've done everything right. Sleep, exercise, eating right, avoiding stress, just doing it all right. That's my system. So I plan to get the coronavirus, and I'm not joking when I say I'd like to get it over with. I'd kind of like to get it over with. So, I'll give you some herd immunity if I survive. I'm in the high-risk category because I'm over 60 and I've got some asthma. But I plan to beat it, and I plan to be part of, I think Naval Ravikant was tweeting that we may see, what did he call it, the immune corps. So he coined a temporary name for it, the immune corps. The people who got the coronavirus, recovered, have some immunity, they will be like gold in the future. 6 months from now, which would you rather be? Somebody who got it and recovered 6 months from now, or somebody who didn't get it yet? You know what I'm talking about, right? You'd rather be the one who got it and got over it 6 months from now. Because if you're still hiding in 6 months and worried about it, it's just not going to be fun. So the president's strategy, the CDC strategy, Dr. Fauci's strategy, I'm fully embracing. Get really healthy. And by the way, Fauci says this too. This isn't me talking. This is the best experts in the country telling you to take care of yourself. It's never been a national priority. Any other time that you selfishly took care of yourself, it was a little bit selfish, wasn't it? Wasn't it? You know, looking out for your own health, getting enough sleep, it's a little bit selfish. But not today. Today it's not selfish. You are all part of this giant experiment. Well, it's not a test. This is the real thing. You are all part of this fight against this virus. And you need to be as strong as possible. So build up your immunity so that you're not one of the ones overloading the hospitals. Build up your immunity. Do it. Somebody says, you can have opinions, but not us. Well, let me clarify. You can have all kinds of opinions, and I welcome them. And I like the opinions that have reasons. The opinions that will be unwelcome are mind reading. If you have an opinion about what I'm thinking, you're welcome to it. Certainly. If you have an opinion, a private opinion, about what I'm thinking internally that you couldn't possibly know, you're welcome to that opinion. But if you say it in public, I'm going to block you because it's stupid. You're totally allowed to have stupid opinions privately. I just don't want to be exposed to them. If it's a stupid opinion about what's in my head, you can have stupid opinions about other things as long as you show your reasons. I'm okay with that. All right. Do we know you can't get it once you've had it? I mentioned that earlier, but it's worth mentioning again because other people have come on here. The experts are talking about building up a herd immunity. The only way that you could have herd immunity is if, in general, you can't get it more than once. Now, is it true that somebody could get it more than once? Maybe. Could be. But in general, that's not a thing. Otherwise, we would not be trying to build up a herd immunity. It wouldn't make sense. Somebody says, why not get the flu now before hospitals get overwhelmed? Well, you're reading my mind there. You're reading my mind. You don't want to be the last person who gets it. Well, the last person would be fine. You don't want to be the one in the middle because there's going to be a wave. So you want to be one of the first or one of the last. And one of the last would be pretty good because then they figured it out and they're past the bump. Thank you. But for the benefit, and let me be really clear about this, if I were being selfish, I would actively infect myself. That's the most selfish thing I could do. Get it over with. Maybe I die, maybe I don't, but I'm going to get infected anyway, I figure. And I would rather do it now before the hospitals are overwhelmed. So if I were going to do it for selfish reasons, I would actually be looking for it. I'd be hanging around those nursing homes. Not really, but you know what I mean. But if I am being a team player, what is best for the team is that all of us fight like mad weasels to avoid it. Because that's really just slowing it down. And slowing it down is what we're really trying to do. So for the benefit of the country, I'm going to try to avoid it. But that's not what's good for me. So if it makes you feel better, don't be the one who's afraid of getting it. Fight for the country, the world really. Fight for the country to not get it right away. Fight hard to not get it right away. But what's good for you is to get it, honestly. It's the best thing that could happen to you is to get it and get over it. So don't worry about getting it. That's sort of the good news in this bad news world we're living in at the moment. The last thing I'm worried about is actually getting it, but I'm going to fight not to.